Hello, welcome to the HealthInn Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be.
Hello everyone. Welcome to the HealthInn Show. This HealthInn Show is by Homeopathy World Community. Homeopathy World Community is the community who is by the homeopaths, both for the homeopaths and for everyone else. So Homeopathy World Community was founded by Devi Brak, who are not living in this world, but in every heart she is living. So I am currently a CEO of Homeopathy World Community, and in today's world, we are living with so many things. And today, I am talking about a metabolic disorder called as a polycystic ovarian disease, or in today's the latest word is polycystic ovarian syndrome. In before 2013, it was called a small disease, but now it is a syndrome because I am working since 2008 on this topic and treated more than 500 of females and solve the cases. So today I am not going to be a part of the scientific session. We are just talk. If you want to take anything from my side and you want to take any input, you just chat us or you just send the message to us. I will try to reply you. So if you are not aware about this show, then I already told this show is by Homeopathy World Community, and the platform is nishancommunication.com. The producer is Mr. Emnan, who is always doing for everything for SWC. And since 2012, we are doing a show. Uh, Many events are there. So homeopathyworldcommunity.com is the domain. Any homeopath can join the Homeopathy World Community by taking a few steps. The website is will be live in 1 or 2 days. You can register yourself. So today I am talking about a uh, little name of the disease, but it is very widely spread. That is called PCOS. The PCOS I already told you about. The word is meaning by polycystic ovarian syndrome, which is the most common cause of the female irregular menses in today's world. The first symptom is the irregularity of the menstruation cycle, and when the female is not menstruating very regularly, then she is having many kind of troubles like obesity, like hirsutism, like deeper voice, like male-like structure, the overgrowth of the hairs on the facial, on the face, and unnecessary unwanted hairs on the body. Hair fall is one of the symptom, but the main symptom of PCOS is the irregular menstruation cycle. So many female does not aware about this disease when they are treating themselves by many things, like they are not taking a good diet, they are not taking any good exercise, they are not taking it seriously. So when a female is not menstruating properly, so here you should know about what is the normal menstruation cycle. In theoretical definition, the menstruation cycle of any female is of 28 days, but it might be plus or minus 7 days, either before 7 days or either the 7 days extra. So if the bleeding is coming into 27 days or 22 days or 32 days or 36 days, it is counted as a normal. But the latest definition is says if the female is menstruating on 42 days or 46 days and it is very regular to the 46 or 46 days, then it is also considered as a regular cycle. So every female must know about what is the irregular cycle. So here today we are just talking about the irregular menstruation and the disease called PCOS. So in between, if you want to chat with us, you just go to nishancommunication.com/healthin.php, and if you want to call us, then you can call at 561-518-8255. Many theories are saying that the obesity is one of the cause, but in today's era, obesity is not one of the cause of PCOS. It is just a risk factor because we are seeing in many sports women patient or the thin ladies, a thin female, the menstruation cycle is irregular and PCOD appearance on the ultrasound is there. So, what is the cause behind it? The cause are one of the main cause is the genetics. If your parents is having the irregular cycle, if your mother is having the irregular cycle, or if your grandmother or uh, in any member in the family who is the female and have the irregular cycle or has the history of infertility, then you should aware about it. You should be a PCOS female. The another cause is the dietary maintenance and the exercises. Many of the female is not aware about the diet during the menstruation especially, and what are the exercise doing want to do. uh, that is the main problem. So when I am seeing the patient of PCOS, I every time suggested that the medication is important, but the more important is the diet and the regular exercise. So for the every female, especially in India, I am suggesting to take low carbohydrate diet, like reduce the milk diet and reduce the wheat diet, and many carbohydrate diet you should remove from your diet and take the more fiber diet and more protein rich diet. So this is I always advise to every female of the PCOS. And the second one is the pelvic exercise, because in last 10 to 20 years the female is not doing very much exercise, especially of her pelvis. So I always advise the exercises of the pelvis, and this is the one of the main cause. When the uterus is not working properly, the ovaries are not working properly. So this is one of the most common part of our treatment. So you cannot only treat yourself by the medication, you cannot only treat by yourself by the diet or either from the exercise. So every step is necessary. Medication is necessary, diet is necessary, and the exercise is necessary. Regarding the medication, because I am a homeopathic physician, so I always advise to take homeopathic medication, as homeopathy is it it is one of the medical system who is working on physical symptom with the collaboration of mental state. So in the entire world, homeopathy is the only medical system who is working with the mental state. What is the meaning of that? The meaning is like if a person is having a fever, then how is how is he react during the fever. Like if he is having much more anger, then the medicine are different. If he is cool, then the medicine is different. If he is more thirsty, then the medicine is different. And if he is thirstless, then the medicine is different. So homeopathy is an individualized system of medication where the symptoms count, where the exactly how you behave, how is your mental state behave. So how is your mental state, that will work, and it will create a single remedy or the individual remedy that will work. So like in PCOS case, because in PCOS case there is not only a cause of genetics or diet or exercise, it may be a cause of psychosomatic illness. So, in every case of PCOD, not even in PCOD, in every case when a homeopathy is working, I am working. So I should talk about her history, her mental state, and what are the causes of her disease. Like I am sharing a case. I am not telling any kind of name, or I am not showing any kind of identity of a female of 23 years who is having her irregular menstruation for more than 6 years, and she already took many kind of treatment including the hormone treatment. Everything failed. Whenever she is taking the hormonal pills, then she got the menses, but if she stopped the hormonal pills, then the menses is again irregular. So she's very feeling very shy to tell about her symptom. I noticed her, and I took more than 5 to 6 consultation to grab her remedy. So what I found a very silent grief in her history. So when she was at 16, it was a case of silent grief, and it was the silent grief um, increased by her father. So the father dominancy was there at the age of 16. What she want to do, her father is not willing to do. So she has fight with her father, and she had many kind of argument. At that time, the menstruation cycle was normal, but in a 5 to 6 months only, the menstruation cycle was irregular, and she was in silent grief. What she want to do in her life, she's not doing. She's just doing a private job, and even she want to do more study. She want to do a reputation in her society, but her father is not willing to do her. So it was a case where I found on the sixth visit. Sorry, in this case, I found the exact symptom on the sixth visit of her consultation, and I found the silent grief in her eyes. Her eye was wet with tears. She is telling many things to me, and when she is telling, she is crying a lot. So it is an individualized symptom when a silent grief is come out. It will appear in many terms. Like it may be possible that the patient is go away from the clinic, or she is crying on the table. She may be crying from outside the chamber. So there are different things, and the medicine are different for every case, even every symptom, even for the every observations. So it is very necessary for a homeopath to take an observation. Every patient is saying the individual symptoms. Every patient is telling her different kind of face expression, which should be noted during the consultation. On sixth consultation, I found her remedy is Staphysagrina. I gave her a few doses of Steph in 200 C potency, and I'm not telling about the doses because I'm just talking about in a layman language, and we are on the platform where we are not prescribing the remedy. Here, I am just telling the case. It does not mean that every PCOS case having the remedy for Steph. No, never, not in homeopathy. So in this case, I use the Staphysagrine remedy in 200 C potency, and I wait and watch for 2 and 3 months, and I see her menses are regular, and in the 1 year, every count of it, the 9 menstruation cycle in 1 year is about normal, and about for the 30 or 32 days she was happy, and after 1 year we just closed the treatment, and even after 3 years she is menstruating very normal. After her marriage, she also got a baby. So it was a wonderful case. I remembered. I have many cases, and I want to tell you that homeopathy is the only medication of medical system of the word that is working with mental state to connect it with the physical state. So there is no remedy, no single remedy in homeopathy for every kind of pain. The medicines are different to different. So if you have any questions, you can always ask me, and I will have an answer. Is I am audible?
Keep going.
Okay. So I'm talking about the PCOS, and if you want to ask anything, you just chat us at nishancommunication.com/healthin.php. And if you want to call us, then you can call by calling numbers 561-518-9773. So this is a health info by Homeopathy Word Community, and every homeopath can join Homeopathy Word Community at homeopathywordcommunity.com, and you can see our updates on Homeopathy Word Community page of Facebook and Instagram. You can also see our page on Twitter, and you can also email us at homeopathywordcommunity@gmail.com. We also invite every home pair to be a part of HealthInn or our coffee chat or at book club. You can review your books. If you are a author, then you just contact us at homeopathywordcommunity@gmail.com, or you can directly go to the website and just register yourself. You will enjoy many things on Homeopathy Word Community. This is a community by the home pets and for the home pets. So I am presenting it next, sharing your with a new case, and it was a case of infertility of a 33-year of a female who is trying to conceive for more than 5 years because she's a single child of their parents, and she married 5 years ago, but they do not get any kind of pregnancy, and she will not even get the pregnancy test even for the first. She is not having any kind of PCOD. She is not have not any history of illness. She is not diabetic. She is physically fit. Every test is normal, but doctor also do not understand how the problem is coming, and there is no fertility is there. So in this lady, when I took case, I found again a very big grief when she was at 14 or 15. So this case is also an example of psychosomatic disorders which can be perfectly treated with the homeopathy. So what I found that at the age of 14, she was in very grief. She was molested by two or three peoples, and it was a very big grief for the year for many years. By that, she is not suffered, she is not getting any kind of disease, but mentally she was very disturbed. She do not want to uh, do any physical relation with any of the male. So when she got married, she was not interested with with her husband, and the mental history, the basically the combination of both husband and wife is not there. So I counsel both of them, and first I counsel for the lady, and on this case I use the Netrum self is the medication. I use the carcinosin of the medicine. There are many medication. I am again repeating that I am not prescribing any kind of medication here, because this is an open platform. We are not prescribing any kind of any. We are just sharing how homeopathy can help. By these doses, she was very happy. And on the next visit, after 1 month, she told me that, doctor, in this month I am feeling very happy, and I am not having any kind of big stress, and even I am having a good phenomena that is called a uh, positiveness. That is the main thing I found in the 1 month. And you cannot believe, in the next 4 months she was pregnant. She delivered a baby boy, and she was now happy. The baby is healthy. The husband are also happy. And with a single dose of that carcinosin, it was a good. I am putting on the Netcom self and the low doses and high doses of carcinosina. So it was a wonderful case, but it was a story when I got it was very hurting. So I counsel for more than 5 to 6 days, and I select the remedy and given, and in the 4 months of duration, she was get a positive, healthy pregnancy, and she is having a healthy baby boy. So these are the effect of the PCOD cases. PCOS cases are now in today's rising in every country, not in the single one. This is not a disease of single country. It is a disease of spreading worldwide. This is now called a metabolic disease nowadays, like a diabetes, like a hypertension, like many other metabolic diseases. It is come in metabolic syndromes. So this why this is called the metabolic syndrome, because this is many researchers are found, and they are thinking that uh, in many cases the diet and exercise is the major part of uh, risk factors and the causes in the cases of PCOS. Yes, I also agree that the diet and the exercise are play the main role, but your genetics and even the environmental factors are the one of the more common for this, so you cannot ignore it. So if you have any kind of symptoms like that, and if you are not sharing with your consultant, with your doctor, just you just relieving in the symptoms only, not for the cure, not you are approaching the cure of disease. So if you want to cure a disease, you just share your thoughts with your consultant or the doctor. You just share your thoughts with your friend also. So this is one of the main uh, treatment of any kind of PCOS patient, because I am also seeing a few cases of diabetes and diabetes-like diseases. PCOS one of the diseases under in the metabolic syndrome. So uh, we are talking about the PCOS today. If you have any kind of question, you can chat us at nishanCommunication.com/healthin.php, or you can call at 561-518-9773. This show is by Homeopathy World Community. You can reach at SWC at homeopathyworldcommunity.com, and you can ask any question about PCOS. If you are listening from any country, if you found that any female is suffering from the grief, you should talk with her, you should counsel with her, you should take care of her, you should advise a good diet and good exercise for her. So homeopathy can help in many ways in every disease, not single in PCOS. Homeopathy is an holistic treatment, holistic medical system, and it is only the one of the medical system which is going today, because in today's era WH is also announcing that homeopathy is on the second most largest medical system in the world. So homeopathy needs an information. You cannot solve case without the information. You can just relieve the symptoms only, but you cannot remove the disease without the information. So information is very necessary. In our day-to-day practice, many of the female is hiding their symptom even for the months or even for the years. I also want to share one of my case. I started in 2012 and I got the clue in 2017. I took the 5 year to find the exact symptom and the exact simillimum of the homeopathic remedy. Because if you did not find any kind of simillimum in homeopathy, then you cannot treat any kind of cases. So for homeopathy, individualization and the peculiar symptom is very necessary, and it is very important to us that we want to share with the consultant and understand of the book, understand from patient to doctor. Believing is one of the system which can which will strong your treatment, because if you do not have any kind of belief in your doctor, you are not having the good treatment. You are having many kind of symptoms. So believing is one of only contraceptive pills or the hormonal pills are, this is not true. Many treatments are available. Because I am a homeopath, so I have many cases and they published more than 500 of cases. And this is not a truth that the only hormone pills are only the solution. One more common thing is in the female that many of the female are coming only with ultrasound and on a single PCOS. No, this is false. If your hormone checkup is not done along with the ultrasound, your MRI is not done, then you cannot be diagnosed with a single test. It is a responsibility of every doctor that the doctor should check about the hormones. Doctors are in favor of PCOD, then only you can make a diagnosis. Without checking of the hormones, you cannot diagnose as a PCOS. Another thing is the facial hair or the acne or the mood swing is only from the PCOS. No, it may be from another causes like diabetes. This cannot be only by the PCOS. This may be from the genetics. Your acne from the appear from genetics. The facial hairs are due to the genetics. So many things are the genetics. It is not only from the PCOS. Now, what we are doing for the public as a public awareness for every PCOD patient, or if she is not a patient of the PCOD, I always suggest to every female that you should take care of your uterus by doing a good exercise, a good pelvic exercise. You should need to remove the stress from your life. I know in this world you cannot remove completely stress, but as much as possible you should remove your stress from your life. Maintain a good lifestyle, take a proper diet which include the high protein, the high iron rich diet, and less carbohydrate diet. So you should take the diet as a primary things, and maintaining the lifestyle by doing the good exercise and reducing the stress. So these are the common things you should know about the PCOS. There are many cases of PCOD. The main complication of PCOD is the infertility. That's why every female is have a fear that I cannot be fertile if I have a PCOD. So it is not true. Also, in many cases, there are PCOD, but it does not mean that it always causes infertility. Yes, the main complication is infertility, but not is having a good baby and have a good pregnancy. So it is also a myth in the world that if you have PCOD, you cannot be a fertile. No, that is not true. Also, if you have any kind of symptom like your voice is deeper in last few days, you have breast enlargement, you have a sudden face is blood or sweat. So this is a primary symptom of the PCOS. But I already told the irregular menstruation cycle is one of the primary symptom of any kind of PCOS. If you have a regular cycle, then the other symptom may be from many kind of diseases. So you should consult with your doctor and you should check out all the investigations, and you should every kind of homeopathy we should know each and every symptom. So when you consulting with a homeopath, you just note down each and every symptom and share as much as possible. If you're hiding something, you cannot be treated perfectly. You are treating only with the symptoms, not by to cure the disease. So this is all from my side for today. You are watching the Health In Show from Homeopathy World Community, used by nishancommunication.com, and the producer is Mr. Amnan, who is always helping us and always be there for SWC. So, Amnan sir, we have any kind of question in our chat? Hello, Amnan sir, are you listening?
Are you talking to me?
Yes, sir. Sir,
You keep
do
freezing.
we have any question in our chat? I think from not from. Um, is it okay, sir? So, Emran sir, we can end the show.
You need to restart your internet if you can hear me.
Yes, I'm hearing you, sir.
Okay, go on.
Yes, sir. Sir, we can end the show.
You want to end the show? It's breaking up.
Yes, sir.
Okay.
And at the end, I want to thank. Yes. At the end. I want to thank each and everyone, and I want to thank nishancommunication.com and Mr. was from it is from Homeopathy World Community, and every homeopath can join Homeopathy World Community at homeopathyworldcommunity.com. So you can write us at homeopathyworldcommunity@gmail.com. And thank you, Emran sir. Thank you, Nishan Communications.
You are tuned to the Nissan Communications Network. If you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section at nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by StreamingGear.com and DeltaForce.net.